Hey there, wellness warriors. Today we're diving into one of the most critical yet often overlooked aspects of our health. The biggest vitamin D danger that you absolutely need to be aware of. It's becoming increasingly clear that vitamin D deficiency may very well be the number one health issue globally. What's even more concerning is that its true importance is only now starting to come into focus. Experts are even suggesting that vitamin D levels could serve as a biomarker for chronic disease and frailty, providing a powerful insight into overall health. In fact, your vitamin D status alone has shown to be closely linked with how well you're doing in life. If we were to only look at one thing in your blood work, your vitamin D levels could reveal a lot about your current health. We're going to walk through the critical steps you need to take to ensure that your body is using vitamin D effectively. And if you want to follow along, I've included a link below for you to grab a copy of these slides. Now, let's break down what vitamin D actually does in the body. Traditionally, it's been most closely associated with bone health, particularly its role in calcium and phosphorus absorption. For years, it was understood that vitamin D helps the body deposit calcium into the bones, ensuring they harden and remain strong. This discovery was first made back in the early 20th century, when they found that a severe deficiency in vitamin D during growth leads to rickets, an ailment where the bones are too soft and don't develop properly. It was also linked to osteomalacia, a condition where the bones lose their strength. But while vitamin D's role in bone health was the first thing we learned, it's only one part of the story. As science has advanced, we've discovered a range of non-traditional functions for vitamin D. These include regulating immune function, activating and controlling immune cells, and playing a critical role in cell death, apoptosis. It's also a key player in controlling inflammation in the body. When vitamin D levels are low, inflammation tends to rise. Additionally, vitamin D is vital for neurogenesis, the creation of new brain cells and connections. This has significant implications not just for brain repair after injury, like concussions, but also for learning and memory. In the past decade, scientists have uncovered most of these additional roles, reshaping our understanding of vitamin D beyond just bone health. However, many still cling to the old paradigm that vitamin D is only necessary for calcium absorption and bone formation. The question is, while it's true that vitamin D helps with bone health, are we getting enough for all these other crucial functions? Let's talk about some of these functions. Vitamin D plays a role in cell proliferation, the process of generating new cells, and their differentiation, which is how a stem cell becomes specialized into different types of cells, like bone cells, brain cells, and heart cells. This is directly linked to genetic stability, which is essential for maintaining healthy tissue. When vitamin D levels are insufficient, it can disrupt this process, and we begin to see health issues arise, including cancer. Cancer, characterized by uncontrolled cell growth, poor cell differentiation, and genetic instability, has been closely linked to low vitamin D levels. Another alarming issue is the rise of autoimmune diseases. From thyroid dysfunction to rheumatoid arthritis, lupus, ankylosing spondylitis, psoriasis, and even type 1 diabetes, these conditions have all been linked to low vitamin D levels. It's a growing concern that vitamin D could be a key factor in both preventing and managing autoimmune disorders. Then there's the impact on the nervous system. Neurodegenerative diseases, such as Parkinson's and Alzheimer's, as well as mental health conditions like depression and schizophrenia, have all shown connections to vitamin D deficiency. When you start to see just how many systems in the body rely on vitamin D, it becomes clear, this vitamin isn't just important, it's vital for overall health. This leads us to a crucial question. Is vitamin D a cause or a result of disease? The answer is both. If your vitamin D levels are low, it can lead to a host of health issues. But conversely, if you're already sick or have a health condition, your body may struggle to absorb or utilize vitamin D properly, creating a vicious cycle of deficiency and disease. So just how widespread is vitamin D deficiency across the globe? Well, a person is officially considered deficient if their vitamin D levels fall below 20 nanograms per milliliter. Shockingly, estimates show that between 42% and 97% of people worldwide are deficient, with the exact percentage varying by region and country. In areas where food is fortified with vitamin D or where supplements are more common, the deficiency rate can be as low as 40%. However, even in these regions, a significant portion of the population still struggles with low vitamin D levels. In places like the Middle East, the deficiency rate can be as high as 97%. There has been some debate about these numbers, with critics suggesting that such high deficiency rates can't be accurate. Some have attempted to redefine the guidelines, arguing that even at 12.5 nanograms per milliliter, people can still mineralize bones fairly well. However, this view still centers on vitamin D's classic role in bone health, without acknowledging its other, far-reaching functions. When it comes to vitamin D, the current guidelines for what is considered optimal are often focused solely on bone health. For example, if your vitamin D level is under 20 nanograms per milliliter, you're officially deemed deficient. But even levels below 30 nanograms per milliliter are considered insufficient. And while this may seem like a gray area, these numbers are mostly tied to the classic role of vitamin D in mineralizing bones. The bigger question is, what is truly optimal if we want to benefit from all the hundreds of essential functions vitamin D plays a part in? So, let's take a closer look at the necessary steps involved in properly utilizing vitamin D. Traditionally, we've been taught that our bodies synthesize vitamin D when our skin is exposed to sunlight. However, many people today struggle to produce enough vitamin D naturally due to a variety of factors. For instance, air pollution significantly reduces our ability to absorb UV radiation, and lifestyle factors such as spending long hours indoors or wearing clothing that blocks the sun also limit exposure. Additionally, people with darker skin tones may find it harder to produce vitamin D because their skin repels UV rays more efficiently. Where you live also matters. People closer to the equator tend to have better access to year-round sunlight, while those farther away experience lower sun intensity, especially during certain seasons. The time of day you're exposed to sunlight also plays a role. Late afternoon sunlight isn't strong enough to produce much vitamin D. Even as we age, our skin becomes less efficient at converting sunlight into vitamin D. Other health conditions, like insulin resistance, also interfere with vitamin D production. Insulin resistance is increasingly common, with about 80% of the population being affected to some degree. This condition, often linked to a diet high in carbs and sugars, disrupts the body's ability to process vitamin D. Given these challenges, for most people, getting vitamin D through diet or supplementation is the most practical solution. However, the availability of vitamin D from food sources is limited. Some of the richest dietary sources include cod liver oil and cod liver pate. Additionally, irradiated mushrooms, which are exposed to UV light, are another good source. Animal products like butter, cream, and eggs contain small amounts, but not enough to meet your daily needs. Thus, supplementation becomes the most reliable way for most individuals to ensure they're getting enough vitamin D. Once you've consumed vitamin D from food or supplements, it enters your digestive system. Since vitamin D is fat-soluble, it needs to be taken with fat to be properly absorbed. For optimal absorption, it's best to consume vitamin D with the largest meal of the day. This increases absorption by 50% because your body is also processing other fats and digestive enzymes during that time. However, simply absorbing vitamin D is not enough. It needs to be properly transported throughout the body. This is where the vitamin D binding protein, VBP, comes in. This protein carries vitamin D through the bloodstream to the organs where it's needed. If VBP levels are low, the effectiveness of vitamin D is diminished. For example, low VBP levels have been linked to an increased risk of certain cancers, including breast, prostate, and colorectal cancer. Even with sufficient VBP, getting vitamin D into the cells is the next challenge. This process depends on vitamin D receptors, VDR, which are present on nearly every cell in the body. These receptors are most concentrated in areas where vitamin D's effects are especially important, such as the kidneys, immune cells, and bone cells. Interestingly, the substantia nigra, a part of the brain that produces dopamine and is associated with Parkinson's disease, also contains a high concentration of VDRs. When vitamin D levels are low, these receptors cannot function properly, leading to a decline in dopamine production and an increased risk of Parkinson's disease. The hypothalamus plays a crucial role in regulating essential functions like hunger, thirst, body temperature, and hormone levels. When these processes become impaired, it can lead to neuropsychiatric effects, such as schizophrenia and depression, and cognitive issues like Parkinson's disease, motor disorders, and dementia. Additionally, hormone imbalances and various endocrine disorders, including diabetes, are strongly linked to vitamin D deficiency. Both type 1 and type 2 diabetes have been associated with vitamin D receptors. When vitamin D is low, insulin production decreases, impairing the body's ability to manage blood sugar effectively. The most concerning aspect of vitamin D deficiency, especially in type 2 diabetes, is its relationship with insulin resistance. When vitamin D levels are low, insulin resistance increases, further hindering the body's ability to regulate glucose levels. Moreover, vitamin D plays a crucial role in immune system regulation, so a deficiency can weaken the body's defense mechanisms, making it more vulnerable to autoimmune diseases, including type 1 diabetes. However, even if we successfully get vitamin D into our cells, there are other factors, called cofactors, that affect its activity. Cofactors are nutrients or compounds that assist in the process of vitamin D utilization, and they work synergistically with vitamin D to ensure its effectiveness. The most important cofactor is a diet rich in whole, healthy foods. These foods, when properly prepared, provide more nutrients and cofactors than any supplement or processed food could. On the other hand, consuming a lot of processed foods and sugar may create nutrient imbalances that hinder vitamin D processing. Another crucial cofactor is exercise. Regular physical activity activates nearly every cell in the body, allowing it to function at its highest potential. Without exercise, vitamin D cannot perform optimally, as your cells aren't being fully activated. Along with healthy food and exercise, adequate vitamin D intake is essential. Whether you're getting it from sunlight or supplementation, you must ensure that you're getting enough. Other vital cofactors include magnesium, which participates in hundreds of chemical reactions in the body, and omega-3 fatty acids, EPA and DHA, which help activate and transport vitamin D. Zinc and boron also play key roles in vitamin D activation, and vitamin K2 is important for calcium metabolism and bone health. Some people may need to take vitamin K2 as a supplement, while others can produce it through their gut or get it from food sources. It's often recommended to take vitamin D3 with vitamin K2, but I've found that starting with vitamin D3 for a few months and then adding K2 works best for many individuals. Now, let's talk about how much vitamin D you need. Most experts agree that supplementation is necessary for many people, but how much should you take? The general recommendation is 600 IU per day for most adults, with an increase to 800 IU for individuals over 60. In some countries, the measurement may be in micrograms, and you can convert IU to micrograms by dividing the IU value by 40. For most people, 2000 IU is the upper limit for vitamin D supplementation, but this might not be sufficient for everyone. While 2000 IU may work for some, many individuals, based on genetics, sun exposure, and other factors, will need more. Some people may need 5000 IU per day to maintain optimal levels. However, even at this level, some individuals still show deficiencies in their blood work despite consistent supplementation. In certain cases, people might need to take up to 10,000 IU per day for a short period, 1 to 2 months, to correct severe deficiencies. While high doses like 10,000 IU may be effective in the short term, long-term use can lead to vitamin D toxicity, which is something to avoid. With so many variables involved, genetic factors, sun exposure, diet, etc., it's essential to get your vitamin D levels tested. A blood test will give you the most accurate assessment of your vitamin D status. If you haven't already, make sure to request a vitamin D test the next time you have blood work done. What are the ideal vitamin D levels? In the US, vitamin D is typically measured in nanograms per deciliter, (mg/ml), but other regions may use nanomoles per liter, moles/L. To convert from ing/ml to moles/L, simply multiply by 2.5. If your vitamin D level is below 20 nanograms per milliliter, you're considered deficient and in the red zone. If it's between 20 to 30 nanograms per milliliter, you're in the orange zone, which means you're insufficient. For those focused on optimal health, especially in functional or holistic medicine, the lower limit of optimal vitamin D is generally considered to be 50 nanograms per milliliter, 125 moles/L, with the upper limit around 80 nanograms per milliliter, 200 moles/L. Most people aim for levels in this range, with some preferring the higher end to ensure maximum benefits. While some individuals might manage with vitamin D levels around 30 nanograms per milliliter, as we've discussed, there's a significant amount of individual variation when it comes to vitamin D absorption, transport, and receptor activation. Factors like binding protein availability and coactors can influence how effectively your body uses vitamin D. If any of these steps are compromised, whether due to genetics, lifestyle, or health conditions, it's likely that your body will need higher vitamin D levels to compensate. If you're sitting on the upper end of the optimal range, you're probably in a good place. However, we've seen patients come in with levels over 100 nanograms per milliliter, and this is where caution is needed. Excessive vitamin D intake can lead to toxicity, which can cause elevated blood calcium levels and a range of serious issues within the body. That's why it's crucial to monitor your vitamin D levels regularly. While vitamin D toxicity is relatively rare, it is possible, especially when levels exceed 150 nanograms per milliliter, or 375 moles/L. To reach such levels, you would likely need to take tens of thousands of IU for a prolonged period. But it's important to note that some people have reached dangerously high levels with much lower doses. In some cases, a person might take just 2,000 to 5,000 IU daily and reach the 100 nanograms per milliliter mark, while others may require 10,000 IU to get there, and in some rare cases, they still don't reach sufficient levels. This variability underscores the importance of measuring your vitamin D levels. Without regular testing, you can't know for sure where you stand. The only way to know if you're in a healthy range is by getting regular blood tests. We recommend starting by measuring your levels and supplementing based on the results. After the initial testing, it's advisable to check your blood work every 2 to 3 months until you find the right balance. Once you've established a baseline and your levels are stable, you don't need to test as frequently. As a general rule, rechecking your vitamin D status every 3 months is a great strategy when adjusting your supplementation. As you continue monitoring, remember that achieving balance with vitamin D is about more than just numbers, it's about your overall health. Whether you're addressing bone health, supporting your immune system, improving cognitive function, or reducing inflammation, vitamin D plays an indispensable role in the body. But keep in mind, vitamin D alone isn't enough. Healthy food, exercise, adequate magnesium, omega-3s, zinc, and other cofactors work together to ensure your body absorbs and uses vitamin D optimally. So, don't treat vitamin D like a simple supplement. It's a critical nutrient that influences a wide array of bodily functions, and it's too important to leave to chance. Take control of your health, monitor your levels, adjust your intake based on reliable tests, and stay informed about how your body processes this vital vitamin. Now, if you found this video helpful and informative, you're going to love the next one. If you're serious about mastering your health and truly understanding how your body works, make sure to subscribe, hit the bell icon, and turn on notifications so you never miss a life-saving video. Together, we'll help you unlock your full potential and optimize your well-being.